So this is going to be my second video and I'm going to talk about preparation for surgery. This is if you've had your surgery planned, so that's what I'm going to talk about. Obviously some people might have their surgery as an emergency, in which case, you can't prepare for it. Number one, you are not alone. There's a lot of people out there and a lot of support that's available. You never have to be on your own with it. Number two, the medical team. The medical team is made up of a lot of people. You'll have your own medical team. This is from surgeons, other surgeons involved, your gastroenterologist and your stoma nurse. There's also other people involved, like you might have a dietitian, there's the person that deals with your anaesthetic, you might even have a counsellor to deal with it. I know some people who have had counselling to help them come to terms with it if their operation has been quite a way off. Obviously, these people, they give you a lot of information, and it's important to remember that it can be really overwhelming, so don't worry if you can't take in all the information at once. It'll all sink in time, and it is very overwhelming either way because it's such a major operation. Number three, there's a stoma nurse you get. They are there for you before and after your surgery, and even me now, I'm 2 years and 8 months after my surgery and I still ring my stoma nurse. She's there if I need to talk about bag leaks, skin irritations, diet. You'll have their contact numbers, which, they're available for you to use anytime you need them, and, don't be afraid to make the best of their input and their help. My stoma nurse, she's lovely and she was a godsend to me, and she's part of the reason why I came on so much, I think, after my operation in the way that I did. Before your surgery, they'll ask you about your lifestyle, your diet, what sort of clothes you like to wear, your exercise levels. You might be a horse rider, or you might enjoy cycling or swimming, all of which you can still do after your surgery, if you pick them up in gradual levels, and you can still do what you did before your surgery. A lot of people think you can't go swimming and things, but you can. I've been, and having a bag doesn't stop you. Obviously, if you do a lot of exercise, or if you don't, it's important that the stoma nurse marks where your stoma is going to be in the right position. You don't want it in a place that's going to be awkward for you, so it's vital that they ask these questions and that you answer them the best that you can to make their job easier and ultimately make your stoma that's going to be with you for a period of several months or even the rest of your life, it's there and it's in the right position, so it's convenient for you. She or he may introduce you to other people that have stomas. Personally, me, I was introduced to one of the nurses at the hospital who is a few years younger than me, who has a stoma, and seeing her and seeing how well she'd come along and how much she'd progressed, that really helped me sort of envisage how I was going to cope with things after my operation. She also may invite you along to stoma support groups. They run some, I know my hospital runs them sometimes on a Saturday morning, and you get obviously people who have stomas already going along, and you also get people from the stoma care companies, like Salts is an example of a stoma company, or Coloplast. You get representatives from them coming in and doing little talks, and obviously you can ask questions, ask as many questions as you like, talk to people who have them already. You'll get a lot of appointments with your stoma nurse, and obviously they might give you information packs as well. Information packs can be quite huge, so just try and take in little bits of information and often. So number four, the surgeon. Your surgeon, really, seeing as they're doing their operation, they're the main sort of person that you rely on, and you'll have quite a lot of appointments with them leading up to your surgery. They'll explain your procedure, they'll tell you how long it's expected to last, what they're going to do, and my surgeon drew a little diagram for me on the back of my hospital notes, so that helped me to understand what was going to happen. It's your opportunity to ask questions. You know, no question is stupid. If it's come across your mind and it's affected you, then you ask it. They're there to, you know, support you, and if possible, or if you need them to, they can link you to other support available as well. And quite often your stoma nurse will sit in on the appointment as well when you're with your surgeon. Number 5, Facebook and other support groups. I find Facebook really good. A lot of the support groups are closed, which means people that you don't want to know about your operation on your account will not know. They won't see you posting, they won't be able to access the group that you're in. It'll just be the people on the group that are able to access what you've said and posted. You can ask for tips from other people. It's great, you know, to be able to go on Facebook and, for example, if you're too poorly to get out or it's too overwhelming and you don't want to speak face to face to somebody, it's great just to have that convenience of sitting behind your keyboard and still being able to get, you know, a whole array of support from people. You can also visit blogs like mine, for example. There's other people's. You can type in things like living with a stoma blog or ileostomy blog, and Google will bring up a whole range of things. Also, there's YouTube. You know, there's lots of videos on changing an ostomy bag or people explaining what an ostomy is with diagrams. There's a whole, you know, wide range of things, especially on the internet out there. There are also things locally, if you don't have the internet, like local support meets and groups, which your stoma nurse as well will be able to get you in contact with. Number 6, you can actually get fake stomas and bags. So before your operation, you can get, like, they give you a little fake stoma about that big, and it's got a little like red ring round it, and they'll give you the adhesive so that you can actually put it on your tummy, and you get given the bags which you can put on top, and little syringes where you can put water in and things, and practice emptying your bag and walk around and feel how it feels having a bag that's got a little bit of output in it. Well, water, not output yet, but the water that you put in it, and you might want to try on clothes with it and just really get a feel for it. Obviously you can't feel how it's going to be when you have a stoma that's working, but on the bag side it'll help. 7, the question that everyone always asks, including me: will I need the horrible bowel prep? Well, me, in my experience, I didn't, yes, which was just, oh, I had a huge sigh of relief, probably the biggest sigh of relief in my life. Everything needed taking out anyway, so I was told it wasn't needed. I was also very, very poorly. My operation was meant to be a month before I actually had it, but I was bleeding quite a bit inside and got put on intravenous steroids. So obviously, because I was on the steroids, I couldn't have my operation because it would inhibit the healing process. So mine got put back a month, and because I hadn't been eating and things, I was very poorly, so I couldn't really stomach anything. So I didn't have the bowel prep. It depends on the individual case. Some people may have bowel prep to minimise infection, for example, in surgery. Most people are admitted 1 or 2 days before their operation, and they have no food. You know, you get given the bowel prep, you're on clear fluids, things such as black coffee, tea, water, squash. They might let you have jelly and hard-boiled sweets, it just depends. Some people also have build-up drinks, which are preparation drinks that you have before the surgery to give you vital nutrients and things that are going to aid you in the recovery process. Second to last, the day before surgery and the surgery day. The day before my surgery, I had a more detailed discussion with my I don't even know how you say it, anaesthetist, I think that's right, about the anaesthetic I was going to have. I also had numerous visits from my surgeon and their team. I saw my stoma nurse quite a lot and discussed my worries with her, and she came down the night before my operation and marked up the site where I was actually going to have my stoma. You know, she let me stand up and down with my trousers on and saw where the waistband of my trousers sit, just so that she could reassess for one last time and make sure that my stoma was in the best position. And again, you know, it's your opportunity to ask questions. It might be the day before or even the day on surgery, but if you've got something that you really feel, yes, I need to ask that, don't be afraid, go ahead and ask. So last but not least, you know, the important thing to remember, it's a major operation and it's okay to be scared. You know, you wouldn't be normal if you weren't scared. Focus on what the operation will bring for you. For me, I knew that I was in a serious way, but I didn't know that it would save my life, literally. You know, they found an abscess when I got in there, and if they'd have left that 2 or 3 days later, chances are I would not be here. But even then, I was focusing on the fact that the operation was there to make my life better, to give me a life. I didn't have a life, I had no quality of life. It was there not to hinder me, it was there to help me. And yes, I was prepared for, well, as prepared as I could be for, you know, the rough months that would come after it, because I just kept thinking, well, things will get better and it'll get to the point where I can go out and I don't have to plan my journey around toilets. You know, I could actually step out my door. I couldn't do that before my operation. And obviously, the last thing to remember is you're not alone. There's a lot of people in your position, and you know, go out there and find the support. Don't be alone with it. There are a lot of people that are willing to help, including me. So if you're watching this and you want to talk to me or you have any questions, drop me an email, which I've put on my blog and I'll put at the end of this post. There's also my YouTube, there's the comments box below the video if you want to ask there, and there's also my blog if you want to leave comments on there as well. Alright guys, I hope this has helped, and thank you for watching, and I'll do another video again soon. Okay, bye!